The World Health Organization is scheduled to meet to decide whether the Ebola outbreak in the DR Congo constitutes an international health emergency. Only 4 emergencies have been declared in the past decade. So what factors are taken into consideration before a public health emergency is declared? CGTN's Robert Nagila has more.
It's almost 1 year since the Ebola outbreak was declared in the eastern DRC. More than 1,650 people have died in the current outbreak, with about 12 new cases reported every day. On Sunday, the first case of Ebola was confirmed in Goma in eastern DR Congo, a city of about 2 million people, while neighboring Uganda has also registered cases of the virus. So what is taken into consideration before an international emergency is declared? First, an independent panel of medical experts who sit on the World Health Organization Emergency Committee meet to evaluate the latest evidence and if it constitutes a public health emergency of international concern. Their assessment traces early origins and the subsequent evolution of the epidemic, where we currently stand, and current outbreaks. This include epidemiological projections of how the epidemic is likely to evolve. This information is provided from a risk assessment conducted by the WHO to identify preparedness of neighboring countries. If an international health emergency is declared, public health measures such as funding and resources are boosted. Recommendations on trade and travel are also issued. The panel, which twice before decided not to declare an emergency, has only declared 4 emergencies in the past decade. They include the H1 virus that caused an influenza pandemic in 2009, West Africa's Ebola outbreak, polio in 2014, and the Zika virus in 2016. Robert Nagila, CGTN, Nairobi, Kenya.